Okay, so today we'll talk about EMR. You call it as EMR or EHR, electronic medical record
or electronic health record.
Okay, so you can call it EHR or EMR. Both means the same thing. So we'll talk about how to manage from the clinic. Okay, so EMR is a software that helps to manage a clinic. So what is an EHR? Okay, so see, when you run a clinic or hospital, right, you need to manage the record, right? So what are the things that can you store in a health record? Can you think and tell me?
What, Saurav? Can you ask it again? What are the things?
What are the information that you can save in a health record? As the name says, it's record, right?
Yeah, so, like the patients are like from admitting patients to like discharging, in between their prescribed medicines and their treatment, and the prescribed doctor, like specific doctor, and all these details and their payments.
Okay, what else?
All the medical information related to a person.
Anything else you can think of?
His the patient treatment details.
Okay, that's right. Okay, so see, first patient comes into the clinic, right? So the first thing that you will save is patient basic information. Okay, so patient basic information like name, address, phone number, etc. Okay, and then your EHR will be able to provide appointment. Okay, so who all will use EHR? EHR will be used by a receptionist for entering or saving patient information, and nurses to add what we call as vital stats in healthcare. Okay, vital stats means like like your temperature, height, weight, blood pressure, right? So every visit you go, these are the things that they will definitely measure, right? Okay, whatever complaint you have, right? They're going to measure these things, isn't it? So we call it as
vital stats.
Vital stats, right? So your nurse will measure this. Okay, so okay, so second person to use, okay, your EHR is nurse. Then you'll go to doctor, right? So doctor will be able to see your previous history, right? Okay, doctor should be able to see, okay, your previous history and your lab reports, your your medicine that you are taking. Okay, so so doctors will use right. So these are the three people. Then hospital admin can also watch to see which resources are available, which rooms are free, right? If they have to create any kind of report, so admin will be using. You'll also have IT team, okay, who's going to manage, okay, the permission access. Let's say you're not able to log in, okay, something wrong with your access. So you'll have IT team, your admin team, doctor, nurses, and receptionists, right? And of course, you can think of more people accessing it. Okay. Now, each of these people will use it for a specific purpose, right? So as we discussed, receptionist to register a new patient, to create appointment, cancel appointment, nurses to add those information, doctors will use it to see or to first to enter your complaint and the prescription that they will give you based on your complaint. They can watch, they can see, okay, your previous history. Okay, that's the main purpose. Okay, um, we used to we shown a video where a person meets with an accident and the person is unconscious, right, and arrives at the hospital. Now, if you can open the patient history, okay, based on name, like if you can find purse in the pocket or driving license, or using that you should be able to get access to person detail. So you will know what kind of problem that person is facing, right? Is he diabetic, or he has any allergy to any medicine, right? Now patient is unconscious, they cannot tell you, but then medical record will be able to tell you about that, right? So so that's the advantage of creating a medical record. And now government is planning to make regional centers, and all the hospitals will be able to share the medical record. So when you move from one city to another, your one hospital to another, you will not have to carry your medical record. Okay, so earlier it was at hospital level. Now they are planning to, or a lot of work has already been done actually. Okay, you can, in fact, even in other state, if you move other state, doctor will be able to pull your medical record. Okay, now again, the medical record information from one hospital to another hospital will travel via EDI. So let's say hospital 1 will enter details and request for your record, and this hospital will approve, saying yes, make it available. So when it says make it available, information will again pass through EDI to the new system, right? Okay, so that's the advantage of using your medical record. Now sometimes it happens that let's say doctor knows that you have a say allergy, but still they can prescribe medicine, okay, which contains the product that you are allergic to, right? Sometimes it happens, right? Human beings, we can make mistakes, right? So if in that case, the system will alert saying this person has an is allergic to this, right? So you can create alerts. Okay, these are rule-based alerts which you can create, which will help the doctors to make a better decision. Agreed? Yeah, you understood what I'm saying?
Yes, sir.
Right? Yes. So that's why it has a lot of use case. Okay, you don't have to carry your medical record. Doctors can see, okay, can look at your history without going to the document. And in a big hospital where all the departments are connected, if the doctor prescribes a report, let's say, okay, or let's say lab test, okay, so doctor from the system itself can trigger the lab test. Okay, and when lab test results are available, it will automatically appear in your system, right? So you don't have to carry paper. You know the problem of paper, right? Problem of paper, it can get lost, torn, right? You might forget at home when you go to a hospital. You might forget to carry your previous documents. So all the information is available to the doctor in the portal, okay, which they can access to, right? Okay, so that's the purpose, that's the usage, okay, and purpose of patient record, right? Many times, in the court of law, right? Let's say, for some reason you have to go to court, right? Or for let's say your insurance company is not paying you money, right? So you can take the help of medical record, and medical records are legally accepted in court of law. Okay, so you can carry this, and you can talk to doctors or lawyers or to the insurance companies and say that this is my complete history and I deserve the whatever insurance amount that is there. Okay, so electronic health record is a repository of electronically maintained information about an individual's lifetime health status and healthcare. Okay, then we know computer-based patient record, or you have paper-based or electronic-based, right? So computer-based means it's a electronic-based. Okay, and this talks about advantages of computer over paper. You know that, right? Inaccessibility, paper you have to carry, but electronic it is always available. Okay, we'll talk about the policies of HIPAA, Health Insurance Portability and Accountability Act. So it says that whenever the information is being transmitted from one system to another, whether you talk about claims, processes, or EDI, or this, so there are some important aspect, okay, which you have to take care. Okay, now see, now you give me your details, right? So that's fine because you have given it to me. But when I pass your details to somebody else, okay, I need to be careful about. I need to be careful in terms of what I pass, right? I cannot pass all the information. So HIPAA is a regulation which talks about when you are moving or sharing patient data, what you can share, what you cannot share. So basically what it says is, if it is sharing with another doctor, let's say I'm your doctor, right? And now you're going to some other doctor, obviously because the other doctor is a different specialist, right? Not because of same specialist. Okay, different specialist. Should that doctor have access to all the treatment that you're undergoing under me? Okay, so it says may not be all, right? So there are some disease, some symptoms which are public. Okay, so any doctor can access, right? So let's say you come to me for 3 kinds of treatment, and 2 of them can be shared in public, and third one cannot be shared. Okay, it is confidential, right? So when the other doctor is trying to access your record, only 2 records which are public can be accessed to them. Okay, not the third one. Okay, third one only when you say. Okay, the doctor will not even know that there is a third record. Okay, only when you say, when you give permission, okay, it will be available. Okay, to maintain the patient privacy. Okay, so many a times, okay, hospital will share the record with a pharmacy company, right? So let's say, when somebody gets hospitalized, they perform treatment. Okay, see, doctors' work is called practice. Isn't it funny? Okay, even a doctor who is 60, 70-year-old, the doctor's work is called practice, right? In fact, it is the correct word only. Okay, because every time, okay, doctor has to decide, okay, what treatment needs to be. It's not like all the patients are same. Okay, they experiment, they actually practice. Okay, and these medicine companies, they actually help the doctors in practicing. So let's say there's a you're looking at a problem or a disease, okay, and there are 3 ways you think can be cured, right? So what we'll do is you will apply 3 different treatment to you will apply 3 different treatments to 3 different people. Okay, and then you will evaluate who has recovered faster. Now you will do with 3-4 such cases, and you will see that okay, treatment 1 is always better and faster. Okay, so now when you know that okay, it is better and faster, next time onwards you will do only treatment 1 only. Okay, so that's how doctor actually practices and learns. So you also want to study the effect of medicines on different kind of people, right? Old, young, male, female, and most of this information as a doctor, they don't have time to do that, right? So it will go to different department, okay, or sometimes it goes to the medicine company, pharmaceuticals, okay, they perform, right? So all the medicine of company A will be shared with company A. Okay, treatment that is done with medicine B will be shared with company B. Okay, the purpose is they can go back and perform the analysis, and they can improve their, okay, they can sorry,
practice.
they can improve their medicine, right?
Okay.
Okay. So so that's the idea. So okay, so when you are sharing your patient information, right, there are few things that you have to keep in mind. Few things like the things which you can uniquely identify the patient, right? Name. Okay, now name cannot be shared. Okay, so HIPAA comes with those guidelines. Okay, when we say HIPAA, those are guidelines, like names cannot be shared, a combination of things which can uniquely identify you, like name, your SSN, your address, and your gender and age. Okay, age alone is not problem. Okay, gender alone is not a problem, but address with gender and age can identify you, right? So address cannot be shared, name cannot be shared, email ID, phone number cannot be shared. Okay, those things you don't need to analyze, right? Okay, so that's what HIPAA talks about. HIPAA talks about when you are, okay, when you are moving, okay, or sharing or transmitting data from outside your system, outside your ecosystem, how should it be shared, what can be shared, all those rules are in HIPAA. Okay, we will talk about HIPAA rules in some time. Okay, now those are the advantage of using computers over paper. I think you know that. Okay, it's a little bit of history about it. Okay, see, people were trying to create records since long. Of course, computer was not there before in like 1920s and 30s, but still people were do that. Okay, and okay, every doctor is supposed to give in writing the prescription. Okay, one second. Sorry, yeah. So okay, so it was mostly paper based and slowly. Now, if you look at other systems, okay, you have something called as hospital information system, HIS. Okay, sometimes you call it as hospital management system, HMS. Okay, HMS or HIS. Now, the focus of HMS and HIS is, okay, focus of HMS and HIS is about hospital management. Okay, so it will talk about different cabins, different departments, different let's say operation theaters. Okay, and hospital will have more than one operation theater. So as a doctor, you have to first book it, right? How many injection is there? Beds are available or not? All those things are job of hospital information system. Okay, there is a difference between what can be in HIMSS or HIS versus EHR. EHR is all about patient history, patient record. Okay, so lab result, okay, medicine, your prescription, all these things will be in EHR. Okay, but which facilities are available, okay, which facilities, okay, which doctor is on duty today, who is on leave, okay, these kind of information will be stored in HIS. Okay, so HIS is something which is which were the first set of software that were developed, and every hospital kind of has it. Okay, EHR came much later. Okay, and see, the information in HIS will not go out. Okay, because HIS is to manage your hospital, and you will manage your hospital only, right? But EHR, since it's a patient record, it can be transmitted, can be transferred from one place to another. Okay. Okay, what are different components of EHR? Integrated view of patient data. What is integrated view of patient data? Can you guess?
Clubbed history of a patient.
History of patient, okay. Okay, so see here, you will have data from multiple types. Okay, see, generally if you look at patient data, right, one would be related to say scheduling, one would be related to personal information, okay, one would be related to vital statistics. When you see integrated view, it is about everything. It is about let's say doctor wants to see, okay, before I arrive at, let's say I'm looking at a report, okay, and the report will have some values. To know the values is whether within the range or not, I might have to look at the patient age, okay, patient current, let's say BP, right? So now BP related will be in different section, right, different page basically, okay. Patient age different will be different page, and lab result will be different page, but you need to see all three together. That's why you call it as integrated view. Okay,
Yes, Saurav.
okay, then what is the next one?
Clinical decision support.
Yes. Okay, clinical decision. So the example which I gave, okay, the clinical decision support, okay, three words here: clinical, something to do with clinic, okay, something to do with medical, okay, decision, the decision that is being taken, okay, who takes the decision there in clinics?
Doctor.
Doctors, yes. Support, so information that will help the doctors to make decision, that's called decision support. Okay, and decision support, okay, mostly it's about the data. Okay, so I told you example, right? A patient is you cannot give a certain medicine because the patient is allergic to a certain substance. That is a decision, that doctor has to make what medicine to prescribe to you, and the system is supporting, right? So that's why the decision like that, which is based on the history and your specific data, okay, is called clinical decision support, or CDS also we call it in short form. So that's an example of CDS. Clinician order entry. Okay, so for every and I'm sure all of us would have gone through hospital and you'd get a report, isn't it? Now, if you go for a blood test, you have a certain kind of form. If you go for some other test, there's a different kind of form. So all these forms are stored in the system. Okay, all these are stored in the system. Okay, now based on whichever form or whichever treatment you are doing, okay, you say performing BT, blood test. Blood test form will come up. That's called order entry. Okay, so the order entry, what all should be added, will come up. Okay, then access to knowledge resources. You can go and check. Okay, not only patient specific things, but let's say some new research is happening. Okay, so there would be a team. Okay, they would look at those important research and put it in the system. So doctors can read and they can even refer to patient. Okay, so for example, you go for a certain treatment. Okay, and after the treatment, there are few things that you have to follow, right? Let's say you can't eat hot food for a day. Let's say for something like that. So that resource can be shared. Doctor can say, okay, read the instruction there. Of course, they'll tell you important stuff, but instead of writing all the 10 or 20 things, they can simply refer to you, right? That's called knowledge resources. So it is pre-built, pre-loaded, and based on the need, it can be forwarded or added to the patient record. Okay, integrated communication and reporting support. So communication, right? The doctors can communicate with pharmacists saying, okay, give this medicine, don't give this component, something like that. So you may not know the technical term, right? So when you go for a medicine, sometimes it happens, right? Doctor says that we don't have this, but we have a similar medicine, okay, same composition. Now, can that be given or not? So pharmacy will quickly ping saying that we don't have this, but this medicine is available. It has this component. It is good. Doctor says yes, it can work. So and proof. Okay, tomorrow something goes wrong, you can always see the proof that the pharmacist did ask, doctor did say yes, and also discussion is fast, right? Because if pharmacist tells you that we don't have this but we have that, you will not understand, right? You don't know, so you have to rush to the doctor and then talk to doctor. So there is a lot of time that can go waste. So immediately pharmacist will ping the doctor, and since it's the same system, doctor also has access to all the information that he or she needs, right? So decision can be taken quickly. Yes, so that is called integrated communication and reporting. Reporting means if somebody wants to take a report, admin wants to take a report, how many patient came for Dr. A, right? And those kind of reports can be taken. Okay, so that's what we do in terms of here. So these are different components of EHR. Can you see this and tell me what you understand from here and what you don't understand from here? First, what you understand. You see this. Fast.
Whatever the departments involved in the hospital.
Tell me, don't say whatever. Tell me what you see.
Okay. See, basically in hospital, obviously pharmacy and the lab, radiology department and all these things are there, right? So they are all included in this database, patient database. So like whenever a patient go to the test, so they'll go to the lab, radiology department. I mean, for scanning or X-ray, they go to the radiology or any other tests, they go to the laboratory. So all the data which are related to the tests and the scanning reports and also their medical prescriptions, they all stored and linked into this database. And also the medical billing financial system. So and also the information which is related to their payments after the treatment, that is also like integrated in this database.
Mhm.
Yeah.
Yes. Okay. So you see here you have radiology, right? So if X-ray or radiology report is required, information will go to radiology department, pharmacy, lab for performing blood tests, other tests, right? So all department is connected. Okay, you have order entry. Okay, so so the department that takes care of order, right? Then data entry, okay, the admin, okay, then event monitoring, okay. Now event monitoring is again the same rule that I told you, right? Uh, it's called drug interaction, okay. So drug interaction is one logic. Drug interaction means so two drugs that, let's say you're already taking one particular drug, okay. Now another drug is prescribed. Doctor may not know what kind of drug you're already taking. Okay, you have not told doctor. So doctor didn't ask you. You have not told. But let's say there's one medicine that you're taking, and this medicine together they can have a negative impact. Okay, so the moment doctor will prescribe, the logic module will give a warning. This patient is already on this medication, so this, okay, may not be relevant. No, of course doctor needs to know, and doctor will then change or advise what to do, right? So these are the things, those can be helpful. Okay, then you have medical entities dictionary. Okay, so all the medical related stuff, and that's also database. Okay, so you can get it. Financial and billing system, okay, also called as practice management. See, what you see here in center is called EHR or EMR. The billing and financial system is called as PM, practice management. Okay, it is to manage your practice. To manage practice, basically you mean money, right? Financial transaction. So your practice management will talk to the insurance company that we discussed other day, right? So, but patient information will come from EHR, right? To apply for a claim, you have to you have to fill in the details, right? All those details will come from EMR. So your PM and EMR will actually talk together. Then you have research database where if research is happening, okay, those things will be captured here. Okay, this is all about EHR. Of course, this is a sample. This is how a EHR screen looks like. Okay, sample EHR screen. So when you log in to your dashboard, patient name, patient age, okay, Stacy Wilson is the patient name, address, okay. This view will change based on who is watching. Okay, doctor's view will be different than nurse view and nurse view will be different than your receptionist view. Admin view will be different, right? Not everything will be shown to everyone. Doctor did not need to know your address, right? Nurse, sorry, the receptionist need not know the medicines that you are taking, right?
Yes.
Okay. So this is how this will look like here. Okay, and lab reports attached here, date. Okay, you can click and you can get the reports as well. Then clinical decision support. This is your encounter form, right? So pediatric form would be different, right? It talks about the vaccines that has been taken and things like that. So every form will be different, right? The entry form here, okay. Advantage is that when you create such forms, right? Of course, first time you have to create it, right? But second time onwards, you know what to ask, you know what to write, okay? Because template is already created. You're using the template. So even if, let's say, you forget something to talk about, the template will remind you, okay? So that you know that you're missing something and you can add. So I'm going to share this, okay? You can have a look at it here. So that is it. And with that, we complete our syllabus also, okay? Okay, no, we'll talk about HIPAA. We'll talk about HIPAA, and then we will wrap up. Dynamic displays based on your login, right? Every login will be part of a group, okay? So when you log in, system knows which group you belong to, will know what access you need to have. Based on that only, you will be able to get that access. Okay. Clinical research, administration, and what are the challenges. Cost and benefit. It can save doctor also, right? The patient, let's say, patient takes doctors to court. So doctor can show the history saying that, okay, this was the complaint and this is what we did. Then again, this was the complaint, this is what we did. So it can, both the ways, right? I mean, into say it's a record, so you can know if doctor has done any negligence or not, or doctor, it can also help to save doctor saying that, this was it and this is how I performed. So, what I did is as per the expected lines. Okay. So I'll share this document. And with that, we are done. HIPAA. Okay, wait. See, it says limited facility access and control with authorized access in place. So only authorized access to the data. Okay. Policies about the use and access of workstation and electronic media. Okay. Now let's say I have, I have saved your information on my laptop, and somebody else connects to a laptop. Somebody else may not even be a doctor, right? That's why the patient, whoever has access to the patient record is important. Sometimes what government might say is patient record cannot go outside the country. Okay, so that means, let's say you're a company, having head office in US and India. So the US team might collect the data and, okay, they cannot share the data to Indian team. because government has restricted the the data from going outside the boundary. Right? So that's what restrictions for transferring, removing, disposing. They also talk about how to dispose a, let's say, for some reason you have taken the customer data for some kind of analysis. Now, you are trying to destroy the hard disk. So there is a rule. There is a process even to destroy the hard disk of customer data. First, you have to encrypt the data, then delete it. Okay, and so there are steps you need to follow. You cannot just simply say format and throw away. Okay. So there are 7 elements of HIPAA. Okay, implementing written policies, procedures, and state standards of conduct. Designing a compliance officer and compliance committee. Okay, every company working in healthcare should have a compliance officer and the team that will work for compliance. Conducting effective training and education so that everybody is aware of the thing. Developing effective lines of communication, conducting internal monitoring and auditing, enforcing standards through well-publicized disciplining guidelines. Basically, anything, okay, that that can damage the data, right? Let's say you carry your patient data in a laptop, and that laptop is lost. In fact, it happened. Okay. And so in that case, what happens? Okay, you have to follow a certain procedure. What it says is that you have to first file a police complaint. Okay, then you need to inform the hospital, and hospital has to inform all the patients, saying that that this is what exactly happened. We had your data, and the laptop is lost. And these are the kind of information that would be compromised, right? So that people know that, okay, this happened. Okay, so in case if they have to change some password, they can change it. They need to inform everyone saying that we have lost your data. It happens, right? Sometimes, companies' website gets hacked. The website will send message to all its customers saying that, website was hacked, and these are the kind of information that they have taken, right? So this is about HIPAA compliance. Okay, so yes, we are done. Hopefully you know more about healthcare now than what you knew 2 weeks back.